Hi everyone! This presentation was brought to you from Savannah, Cheyanna, Samantha, Sandra, and myself, Skyler. We will be discussing autism spectrum disorder by providing a general introduction and examining why it's a spectrum disorder, the symptoms, who it affects, the causes, the diagnosis, the treatment, and the stereotypes associated with it. From this point on, autism spectrum disorder will be referred to as ASD. To begin, ASD is a neurodevelopmental disorder that can cause challenges with social skills, speech, repetitive behaviors, and nonverbal communication. Each case is unique and ranges from mild to severe, which leads us to the discussion on why ASD is a spectrum disorder. The spectrum, which is an umbrella term, is often represented as a rainbow, and people are placed on the spectrum depending on the severity of their symptoms, which range from highly skilled to severely challenged. However, ASD diagnosis is not stagnant since they can learn new skills that will help them move on the spectrum. The spectrum does include Asperger's pervasive developmental disorder not otherwise specified, or PDD-NOS, childhood disintegrative disorder, and autistic disorder. However, in 1994, all these disorders and ones that weren't named due to the ubiquitous severity of symptoms were grouped together due to the similarity of symptoms and placed on the spectrum due to the severity of those symptoms, which leads us into the symptoms of ASD.
Hi, my name is Sandra, and I'm going to be talking about the symptoms of autism spectrum disorder. It's important to note that the symptoms vary in each case of ASD, and the severity of symptoms are different from person to person. The core symptoms of ASD include impairments in social communications, problems in language and related cognitive skills, and behavioral and emotional challenges. We can break that down into ASD having four main categories of symptoms: behavioral, cognitive, developmental, and psychological. Behavioral symptoms would include problems in social communications, difficulty orienting towards people in a social environment, limited attention span, and difficulty relating to others. Some cognitive symptoms that people diagnosed with ASD may have include difficulty understanding and regulating emotions, understanding other people's perspective, and problems with differentiating their own feelings from others. Developmentally, the symptoms of ASD include delayed or impaired speech, problems in use and understanding of nonverbal and verbal communications, symbolic play deficits, and conversation deficits, as well as difficulty in reading and understanding and poor problem-solving skills. The psychological symptoms would include problems in changing routines, repetitive patterns of behavior, depression, and struggles with self-management. Some other symptoms that may be common among people with autism spectrum disorder are anxiety, difficulty sleeping, tics, and sensory sensitivity. Boys and girls experience symptoms of ASD very differently. More boys are diagnosed than girls. This can be because of the way that they each experience their symptoms. Girls are social and like to be with their peers. They maintain a close proximity to friend groups and try to gain access by compensating for their behavior. Also, girls are very talkative and mask their symptoms relatively well. Boys, on the other hand, experience wanting to be alone, wandering instead of playing, and not having interest in social groups. This makes diagnosing boys with ASD easier than girls because they are straying from what is normal behavior. Girls do suffer with more cognitive and behavioral issues than boys when they are diagnosed with ASD. In addition to those symptoms, people with autism are also often accompanied by other health issues, such as gastrointestinal issues, seizures, sleep disorders, neurodevelopmental disorders such as ADHD, and metabolic conditions. Moving on to the frequency of autism spectrum disorder, according to the CDC in 2020, 1 in 54 children in the U.S. are diagnosed with autism. The graph showed on the slide shows that autism spectrum disorder is becoming more common among children in the U.S. This rise does not necessarily mean that more children have autism, but that we are getting better at identifying the symptoms and being able to diagnose more children.
So let's get into the causes of autism. A lot of times it results from an abnormal formation of neuronal networks and astroglial weaknesses. And there's not one single cause of autism, but it can be influenced by a combination of several, environmental and genetic factors. including family history, where, if a relative has autism or if a family has a child with autism, they have an increased risk of having another child with autism. A lot of times, children being born with a low birth weight or being born really early can increase autism. Children born that are less than 5.5 pounds often have a 60% increased risk of getting autism. And children born 32 weeks and under are 2.5 times more likely to develop autism in the future. Genetic mutations can be inherited or can be spontaneous mutations. Sometimes those mutations can increase the risk of autism, including, Fragile X syndrome and Rett syndrome. Those are some examples of a genetic mutation. Parental age can also affect whether or not someone gets autism. So we find a lot that teens and older adults can have children with autism. There's a smaller chance of it, but they have noticed some ties to that. As well as, if anyone's exposed to heavy metals or toxins like lead, mercury, aluminum, arsenic, anything like that, that has also been found to kind of lead towards autism. And lastly, vaccines do not cause autism. There was a little article a while ago that stated that vaccines caused autism, and it kind of sparked a lot of controversy, and people were scared to get vaccinated, and there's still kind of a movement of people not wanting to get vaccinated out of fear of getting autism. And after a lot of scientific research, no, you cannot get autism from a vaccine, so go get vaccinated. So then, looking at the autism distribution, we can see that it affects all ethnic and socioeconomic groups. And a lot of times the minority groups in the developing countries, they're diagnosed later in life, and they're not diagnosed as often as a lot of the higher economic groups and places like that. So as you can see, like the Americas and Canada, we kind of see a lot more cases, whereas other places around the world are kind of diagnosed less.
Hello, my name is Cheyanna, and I'm going to be going over diagnosis and treatment of ASD. There's really no official medical test right now that we can use, such as a blood test, to diagnose ASD, but the signs usually appear around the ages of 2 to 3 years old, but most children are diagnosed after 4 years old. Doctors observe developmental history and behavior and can compare them to a checklist to diagnose ASD. Some common diagnostic tests include ADOS-2, the ABC checklist, CARS, ADIR. The standardized diagnostic test for ASD is going to be ADOS-2. It was developed in 2000 and is now available in 15 different languages. There are 3 levels that ASD will be diagnosed under. You have level 1 being requiring a little bit of support, level 2 a little bit more support, and then level 3 requiring very substantial support. The earlier the diagnosis, the better off the child will be in terms of learning tasks and learning how to navigate social interactions and how to cope with their social challenges. Unfortunately, there is no cure for ASD. However, early intervention can drastically help. Some of these interventions include behavioral and cognitive therapy, which helps people with ASD deal with anxiety, reduce problem behaviors, helps to make behavior more positive for the patient, helps with motivation, and teaches patient skills such as washing dishes in a step-by-step way. There's also medication, and it can be tailored to each individual. SSRIs are used to reduce repetitive behaviors, anxiety, irritability, and tantrums, while tricyclics are used to improve one's attention span. Another large part of helping reduce GI issues with people with ASD is diet. There is also occupational therapy, which teaches personal care skills such as eating and getting dressed. It also helps teach skills to reduce or combat overstimulation. A large part of having ASD is having the speech-language barrier, and there is speech-language therapy, which can aid in communication. Since each case is different, treatment should be tailored to each individual's needs.
Hello, my name is Sam, and I'm going to be talking about the prognosis of autism spectrum disorder. Autism does not affect life expectancy, but the mortality risk among those with autism is almost twice of that of the general population. But besides that, individuals can live happy and healthy lives. The main factor here, though, in their prognosis is their level of independence later in life. And that independence really depends on where they fall on the spectrum with their diagnosis. So it could be anywhere from levels 1, 2, or 3, and their independence can consequently range anywhere from being entirely independent to requiring a little bit support to requiring very significant support. And since autism is not a stagnant disorder, people can learn new skills and grow and live successful and productive lives. But the key here is having early intervention and teaching these individuals important life skills that can help them gain independence later in life. So there are a lot of stereotypes associated with autism. One of the big factors here is they're often seen as weird. It's really prevalent when the child is at school. They're oftentimes victims of bullying, and it's hard to make friends. Another stereotype we see is stimming, which is repetitive behaviors such as flapping hands, rocking, repeating words and phrases. It can happen when the individual is bored, overwhelmed, nervous, or happy. And it's really hard for these individuals to repress the urge to stim. And so that's why they kind of do it whenever they do it, and a lot of people see it as strange, weird, and disruptive, all while the individual really can't help it. And the last main aspect to autism is tantrums. It's a lot different than when a child is having a meltdown because they didn't get what they want. It's really an outcome of overstimulation, anxiety, frustration. Oftentimes they can get violent. A lot of people may stare if it's happening in public, make rude comments, find the situation disruptive, and that's really hard on the parents as well, just because this whole private thing is happening in the public eye. So having education on what autism spectrum disorders are definitely can help reduce these stereotypes. And lastly, if you do want to learn more about autism spectrum disorder, two really cool things are this new Netflix show. It's called Love on the Spectrum. It follows a bunch of different individuals with different variations or levels of autism and how they navigate the dating life and the dating scene. So that's really cool to see. And another individual, his name is Cody Lee. He's blind and he's autistic. And he's a great performer. So you can search him on YouTube and he's very inspirational. So definitely give that a look at. And lastly, here are our sources. Thank you so much.